frame that we need to achieve is very important. Now, a key role in this dialogue with the patient is the physician, is the clinician, and we realized in our UPATI discussions that in fact we have so far not managed enough to get this stakeholder into this debate, because clinicians have a different viewpoint, have a different role to play. They have to keep a certain distance to the fate of the patient to be able to do an objective judgment on the situation and the best treatment forward. But nevertheless, the doctor is the most important source of information for the patient, and therefore we need to make sure that the dialogue on this topic is really working well. So I'm very excited to hear what you're going to tell us about that. Oh, sorry, I didn't introduce you. Everybody here in the conference knows you anyway, so I think this is okay.
So thank you very much, Mrs. Chairman. Yeah, first of all, I would like to thank for the possibility the chairman, the auditory, and Beat Leffler, who invited me to speak as a physician. So very briefly to my person, I'm an ENT physician in Erlangen, and since 2009 I do own the first chair for nanomedicine. And what I'm doing is both. I do treat patients on the one side, ENT patients, and ear, nose, and throat patients suffering especially from cancer. This is one of my specialty there. And on the other side, I do have research facility, institution, where we do follow specific nanomedicine application treatment from the basic, from the bench to the bedside. And with my team, maybe you have seen them. These are the guys who with the white shirt and the C on it, because I do rule this section. This is a section of experimental oncology and nanomedicine. Okay, this briefly to my person, and what we do is the following. Since I mentioned to you that I do focus on cancer, just briefly, 1.6 million people are suffering every year in Europe from cancer. In Germany, around 500,000 and around 220,000, sorry about this German mistake, 220,000 people are dying from cancer. Normal regular therapies are surgery, chemotherapy or radiation or hormone therapy, but according to new studies which were published in a cancer congress last year in Madrid, out of a cohort of 8,000 patients suffering from cancer and they received chemotherapy or hormone therapy, 7% had to stop with this therapy due to very severe negative side effects. And what is the proceeding then for these people is that unfortunately they will die because they don't have any option for any other treatment, and if they don't tolerate this chemotherapy, they will die. And this is a huge amount, 7%, which have no hope for any kind of therapy. So therefore, I think this is essential, and I do see these patients, suffering from larynx cancer, or suffering from breast cancer, suffering from lymphoma, or suffering from lung cancer, or suffering from other cancer diseases. I do face these patients, and for me as a physician, it's necessary not only to give, the normal therapeutic regimes which are available everywhere. Let me say in Europe, we have to really define and formulate new, active, innovative treatment modalities to help patients, and therefore it is necessary to have a parallel development. First of all, of course, research, and the other side, the co-impacting of patients in this involvement. Now, shortly to my section, as I mentioned, we are synthesizing nanoparticles. Since we do have in mind doing a focused cancer therapy using iron oxide nanoparticles with the help of external magnetic field to treat solid cancer tumors and respective metastases. And what we are doing is we are synthesizing nanoparticles, we do characterization, nanotoxicology, biological mechanisms. We are doing therapeutic, we have our own theater in the clinic or in the clinic center for animal studies. We do have a GMP facility to really do then clinical trials. So what is patients' involvement? What we are doing, what I do with patients is, of course, communication consultant. This is consultation. This is a very important tool for every physician, and there are two complementary approaches which we can do. Is first of all is direct representation through participation of the patient in committees or advisory boards, as mentioned before, from the representative. And the other is indirect approaches using methods like reflecting patients' preferences as an input for decision maker. This is important. These are two complementary approaches which patients can use or have to use to be involved in this process. On the other side, qualitative techniques they're very important to gain deep knowledge about the value of new alternative treatments. This is important, and on the other side, these quantitative techniques to elicit patients' preference to alternative options to compare multiple attributes such as benefit and risk profiles. This is important. And what leads this to? This leads to, on the one side, additional evidence about the severity of particular adverse events and tolerance of these risks. This is important. On the other side, to reveal transparency and legitimacy, because if the ones affected by the decisions, and of course they are involved in the decision-making process, it makes the process much easier. And this is an emergent need for patient-based health technology assessment in which patients are empowered to take control in this process. Quantifying patients' preferences is very important because to provide means of transparent and consistent inclusions of patients' perspective and benefit-risk decisions. This is very important, and to help patients to manage, and this is really important, the complex information in these assessments. Because it's often, as you mentioned before, 50 years ago, you mentioned you were a naive patient, now you're an expert, due to the fact that you have a lot of experience due to your own fate, what's going on, and how to understand the language also from physicians. This is very important for the patients. And the absence of adequate representation can be therefore avoided, and of course the possibility to obtain patient perspective on factors which are captured within clinical trials is important. The EMA perspective, and I've read this last week, they mentioned that involving patients in committee of medicinal products of human use, CHMP decision brings the patient's voice into the decision-making process and ultimately contributes to the safe and rational use of medicines or new therapies. Now, to conclude, what is necessary? First of all, to really enable patients in new innovative new treatment modalities, you have to define the respective patient. Not every patient is really, let me say, suitable for new innovative treatment modalities, to my experience. And it is necessary that the patient have a detailed knowledge about the and everybody who is involved in this application of new methods has to have detailed knowledge about the patient's disease, because otherwise the whole process of translating and bringing in a new therapeutic model to patients is not possible. On the other side, also intensive, transparent discussions between physicians and researchers is necessary, and you have to concentrate this, according to my opinion, into a university or in a huge medical unit, like for example university hospital, because there is the only possibility to have really a real exchange between research, new innovation, nanomedicine-driven innovations, and the patient who do need this new treatment. And of course, a detailed information about the pros and cons of this new treatment modality is necessary. And I think also from my standpoint of view, if a patient is suffering from a disease and needs new innovative treatment modalities, there's always beneficial if you have confidence in this decision involved to really then give an objective view of these new therapeutic moments which are given by a new therapy. Yeah, I would like to thank my team. They are involved physicians, biologists, and physicists who really have one aim, and this is one of the things you mentioned before. We do our research in my institution under one roof, and the roof is, or the aim is, helping people. Finding new therapeutic models, and of course there are several mosaics you have to bring together, but the certain aim is to help patients. And what we are doing, as mentioned before by Professor Gernsma, we did organized last year the Nanoworld Cancer Day 2014. We were the German node. We had around 200 people participating. We had stakeholders from industry, because this is necessary, because after a certain period of time, if you're doing research and if you're successful, you have to convince of a certain period of time also the industry, because otherwise new treatment modalities won't come into the broad public application. And yeah, I hope that this was one contribution to bring nanomedicine also in clinics. Thank you very much.